Welcome to Bloor Pain Specialists. We're excited to have you with us for your procedure. Before you come in, let's take a peek at what you might expect on the day of your procedure. When patients come to us for their procedures, they will typically see some of the same faces they saw for their consultations. Our pleasant front desk staff will greet you, check you in, and when it's time for your procedure, they will take you to the pre-procedure change room area. Our staff will check your blood pressure and take you to one of the procedure rooms where Dr. K will start you off by doing some paperwork and a physical exam to confirm nothing has changed since the time of the consultation. Dr. K will answer any questions you may have, and you will meet the X-ray or ultrasound technician that will assist with your case. Dr. V is the chief of our spine pain program at Bloor Pain Specialists. He or one of the other interventional pain management specialists will join you to complete your consent form, answer additional questions, get you positioned for the procedure, and will clean and disinfect the skin over top the body part that is being treated. If you are having a knee procedure, for example, the skin around your knee will be disinfected. If the procedure is an injection in your back will be cleaned with a sterile disinfectant. For patients getting epidural steroid injections, there are a few specific things you should know. Epidural steroids are injected into the space between disc and nerves, not in the spine itself, and this procedure is done with the guidance of a mobile X-ray machine called the C-arm. It is impressively safe with a risk of serious complications between 1 in 800,000 and 1 in 2.3 million, which makes it statistically safer than driving a car. The steroid in epidural steroid injections is a newer cousin of cortisone, and epidural steroid injections are used for treating herniated discs, pinch or inflamed nerves, low back pain, sciatica, or neck pain with symptoms radiating to the arms. Epidural steroids make the local anesthetic last 5 to 6 times longer. This means that you can be frozen for a day and a half or so in some cases. So patients and their family members should plan their day and the next day accordingly to stay safe and to make sure that they can walk with stability or with help so they don't fall. This is the same freezing dentists use, but once teeth get frozen, we don't have to worry about falls because we don't use our teeth to walk. When spines get frozen, we always have to be concerned about the potential for falls, and we will take great care to keep you safe while you're in the clinic. But we ask that you bring a responsible and capable adult with you that can accompany you home.
For those patients coming in for radiofrequency ablation to treat their arthritic back or neck pain, some of the same concerns about local anesthesia hold true, and you should have a friend or family member take you home. Radiofrequency ablation, or RFA, is a phenomenal technique that can keep people pain-free from their arthritis, unable to feel their painful joints for months and months, and in some cases for years. RFA has a few simple steps. Number 1, the same specialized mobile C-arm X-ray machine is used to guide needles to each joint. The patient will have their skin and soft tissues frozen with local anesthetic first before the radiofrequency needles go in. That way, they are comfortable. Number 2, once the needles are in, a radiofrequency wire is inserted into each RFA needle, with the back end attached to the RFA machine. The machine is used to do some sensory testing with the patient, inducing new non-painful, gentle sensations like pressure or squeezing, vibration or tingling in the areas of the body where the patient normally feels pain. Patients are asked to confirm that these new sensations are in the same places that they feel pain in normally. This confirms that each needle is in the correct place. Number 3, an additional safety step is performed by the physician, and sometimes muscles will start to gently pulsate or jump during this phase. This lasts for a few seconds and it is not painful. Number 4, after the safety check, more local anesthetic is injected through each needle tip to keep the patient frozen and comfortable. Then, the radiofrequency energy is turned on to heat the needle tip to break down the nerve endings that plug into each arthritic joint. Number 5, it can take patients 2 to 3 weeks on average to break down these nerve endings and to feel the effects of this procedure. The first few days can have a little bit of soreness or bruising from the needles and the heat, but in 98% of cases this is very mild. Number 6, with the nerve endings broken down, each joint is unplugged, and patients won't be able to feel their pain from these arthritic joints. They can live life with more normal function and become more physically active. Eventually, however, their nerve endings will grow back, and when they plug into their arthritic joints, the patients can feel that same pain again. If or when this happens, the situation is very much like a nerve branch haircut. The patient comes back for a repeat procedure and reports what area or areas need to be treated. This is a simple and safe procedure that can be repeated many times throughout somebody's life. It is a solution to arthritis that does not involve surgery and is OHIP covered. It gives people lasting pain relief so they can come off of their medication, live life more normally, avoid side effects, and it allows them to move more and improve their health overall. If you have any questions about a procedure you're going to be receiving, don't hesitate to contact our clinic.